This video is a recording of a live webinar that took place in July. Please note that offers or discounts mentioned during the recording may no longer be available. Thanks for watching.
All right, well, thank you all for being here. It's so good to see familiar faces. That caught me off guard. But it's exciting to see some of you. Okay, so when I'm going through the presentation, I can't really see you guys. So there is a chat feature. If you need to jot anything down in there, if you have questions along the way, go ahead and put them there. If I don't see them during the presentation, then I'll scroll through and answer questions at the end. But I'm just so glad you guys are here. I'm Dr. Maggie Geis. I'm the owner of Gaia Women's Physical Therapy and Wellness. And our mission today is to talk about some of the myths of menopause that float around, and also hopefully make you more aware that some of your symptoms are real, that we can help you, and that there are real ways to get treatment, to find help, and there are providers that do care and that won't dismiss you. So before we jump in, I'm just wondering if there's anything that you all have either heard or maybe you know about menopause. Maybe it's something you're concerned about or nervous about, or maybe just something that you've been told before that you believe is true about menopause or perimenopause.
That hot flashes are just something I'll have to get used to.
Yeah. That is one. Get used to them, and then they don't happen anymore because they don't stay around forever.
Well, that's promising.
Yes, they will end. They will end.
Woohoo.
Yeah. So if there's anything else that comes up, you can use the chat box if I'm talking, or if you don't want to turn your microphone on. So I'll check back there. All right, so again, just our agenda today is just to share some of the common myths that we hear just as a society, as a medical system. And my hope is that you leave this webinar today just feeling a little bit more motivated and a little bit more confident that you know that your symptoms are treatable and how you can navigate the menopause journey with just a little bit more confidence than maybe you are starting out today. So just a reminder, I appreciate you all being here. We're all very busy people, but if you can put distractions aside, phones or children, I guess, put them to the side. And just kind of give yourself, this presentation is only going to be about 30 or 40 minutes. And I just want you to give yourself the time to learn this information, digest it, ask questions, and really get the support that you deserve here today. So I just wanted to take a moment to talk about some of the feelings that come up when we talk about menopause. They can be nerve-wracking. They can make you feel like you're just unsure of yourself, you're uneasy, you just don't feel like yourself. Sometimes maybe you have gone to the doctor, you've talked about them, maybe you were asking for help, but you've been quickly dismissed as just deal with it, it'll be over soon, whatever you were told. And maybe some of you, as part of what you're doing today, after you've been dismissed or looking for other information, you've gone down the rabbit hole of Google and online health forums and blogs and TikTok and all of the things, and absorbed so much information that you don't even know what's right from wrong and what's important and what's not. And it's just so overwhelming. And so I just want you to know that I hear these things on a daily basis, that we get it, we're here for you. And all of those feelings are very valid because it's the majority of what's going on in society across the board, both just in women's health, but also with this menopause transition. So some of those feelings might be what led you to sign up for this today. Maybe you're here because you're just trying to be proactive. Maybe you're not really feeling the sensations of transitioning into perimenopause, but you're just looking to educate yourself, be empowered, and maybe to figure out what's going to happen down the line. And when things do start changing, to know what to do or who to seek help for. Or maybe you're just curious. Maybe you're currently experiencing some changes and you're just trying to maybe get caught up. Maybe you're trying to learn about what you can do to help yourself, or maybe a family member that's in the same stage as you. Or maybe you're beyond all that, incredibly frustrated. You've been dismissed by the doctors, you're in the throes of menopause, and you're just not finding the answers that you're looking for. All of these are very real reasons why someone would be seeking information. And I hope, again, that by attending this today, you get enough information that you recognize that you're not alone. There is treatment, and there are ways that we can't stop the menopause transition from happening, but there are ways that can ease the transition, and there is real education out there for you. So again, just whatever your motivation, we're here for you, and we're just hoping that we can ease some of those feelings here today. So I just wanted to talk a little bit about who I am just for a moment. I said in the beginning, I'm Maggie. I'm the owner of Gaia Women's PT. I graduated from the University of Maryland Eastern Shore in 2012. I initially was predominantly in the outpatient orthopedic realm of physical therapy. And around 2018, I started transitioning to pelvic health. So I've been practicing pelvic health exclusively for about 6.5 years. And part of my passion for women's health in general, but also just perimenopause and menopause, is just watching my mom and her generation go through it, and just know that the generations coming behind us are, one, not going to tolerate the level of healthcare that's going on right now. They're demanding a lot more. And also, it's just kind of sad to see just women being underserved in all decades of life, but really through menopause. And so part of my passion is just trying to get information out there so that people can find help with whoever provider that may be. But just education is power. And so if we can get the information out there, then people can typically find the right path. So again, I've been treating specifically pelvic health for at least 6 years, with over 200 hours of postdoctoral training in women's health, pelvic floor, and obstetric and prenatal care. And here at Gaia, I'm really proud to say that we've helped over 500 women in the past 4.5 years. And I think that's pretty huge between the Maryland, Virginia, Pennsylvania region. Alrighty, so we are going to jump right in. So the first being, you're too young to go through menopause. Have any of you heard that, thought that, been told that, or even told it to someone else?
Yes, me. I just turned 40 in May and started experiencing severe hot flashes. Usually they start while I'm asleep. I wake up and they linger for hours at the beginning of the day, and then finally they subside. So the people that I have talked to, family, friends, the older generation, or have told me like, oh, well, you're too young. It hasn't started yet. You still have a ways to go.
Yeah, that's really common. So the important thing to know is that menopause is a natural process. It's going to happen. The average age is between 45 and 55, and in the US, that kind of averages out to the majority of people have reached menopause around 51. That's the most common age. The important thing to understand is that like there is a range, and part of what I've already alluded to is that we just need to be treated on an individual basis. And that's part of what's not happening in the medical system, because there is something called early onset menopause, and that's when you start experiencing symptoms between 45. There's also about 1% of women that have premature menopause, which means that you start experiencing symptoms before 40. And the important thing to note is that although let's take the average age of 51, that's menopause is actually when menses stops. So you kind of have to remember back to when the last one was to say you're in menopause. Perimenopause is everything from normal, typical cycles through no period ever. And so what happens is that stage, perimenopause, can take upwards of 10 years. It can last 8 to 10 years before the last period occurs, which means if you're on that track to have your last period around 51, it's quite normal for you to begin experiencing symptoms around 41. And another thing to note, I might mention this later, is that we're seeing women having babies later in life. So we're having women that are postpartum and perimenopause at the same time, and the symptoms are very overlapping. So when they're going to physicians and asking for care, they're like, well, you can't be perimenopausal, you just had a baby 6 months ago. But those things are very real and can overlap. So some of the factors that might contribute to early menopause are genetics. So if you had a mother, sister, grandmother that experienced early menopause, then would be very real for you to also experience that on a similar timeline. Autoimmune conditions that can be like thyroid, rheumatoid arthritis, they affect ovarian function. Autoimmune disorders affect lots of systems in our body, so of course they would affect our reproductive system. Cancer treatments, this isn't necessarily just treatments in the pelvis. This is just like systemic treatments. Just chemotherapy and radiation can damage the ovaries, which can just increase the speed of someone experiencing kind of perimenopause symptoms. Surgical procedures, which would be like hysterectomies, as soon as the ovaries are removed, someone is going to go into menopause. So when you hear about someone having a complete hysterectomy, uterus, fallopian tubes, and ovaries, they will be not menopausal when they walk into the OR, and they will be menopausal, postmenopausal when they walk out of that OR. That's a very significant change. And there are numerous other medical conditions that can lead to ovarian insufficiency and cause perimenopause to start earlier. And then there are behaviors like smoking that will certainly, again, it's just because smoking damages tissue, and that's going to increase the speed of perimenopause. So the important thing to remember about this myth that's out there is that we can't just dismiss based on age alone. So if you are going to your doctor and saying, hey, these are my symptoms, do you think this could be perimenopause? And they look at you and they say, you're 40, of course it's not, like you must be crazy. They are ill-informed, and this is very real. And like I said, it can start 8 to 10 years before your last period. So number 2, common but not normal, right? Leaks are just an unavoidable part of aging. This one's really important because when women believe that something's unavoidable, then they're not going to seek treatment, right? Like if someone tells you that there's no help for you, then why are you going to waste your valuable time and money looking for a treatment that doesn't exist? So this is very important for people to understand, because there is treatment, lots of different options, lots of non-invasive options. And to educate on this means that people can actually have hope and actually find the right provider versus not even looking for a provider to begin with. So, although the urinary incontinence is pretty normal, about 50% of women during postmenopause will experience some sort of incontinence. It is not unavoidable. It is still treatable, no matter what stage or phase you're in. There have been some studies that show that, oops, I'm sorry. I was just saying that 50% of postmenopausal women experience urinary incontinence. So the studies have shown that like not everybody experiences it, but the majority of people do. And a lot of these people are not seeking help because they think there isn't help that exists. So leakage happens for a lot of different reasons, but some of them being that there's just poor pressure management. And by that can just be decreased strength or coordination in the abdominals or the pelvic floor. Sometimes there's tension, sometimes there's just a lack of coordination. But all of those things are surrounding the musculoskeletal system. And a lot of that can be helped in pelvic floor physical therapy. So there are real things that happen to our body during menopause that can affect incontinence though. So there's a decrease in estrogen that affects the weakening of the pelvic floor and affects the tissues. They become thinner, they become less hydrated. And the pelvic floor muscles, when that happens to them, they just aren't as robust, they're not as strong, and they lose some coordination. There's also changes within the bladder and in the urethra. And also weight changes and body composition tends to change during perimenopause and menopause. And so the added abdominal pressure can sometimes affect symptoms like prolapse and incontinence. I think a really interesting thing is that as a society, we spend so much money in helping our incontinence with supplies, whether that be pads or mechanical devices or I don't know, there's crazy chairs out there. There's certain pants that you can buy, pretty expensive things. And it's been found that people are spending upwards of $900 a year on incontinence supplies. And these aren't even really the tools that are healing or correcting the incontinence itself. It's just maintaining it. But what can really help it is pelvic floor therapy. There are numerous studies over many, many years showing that pelvic floor therapy is a highly effective intervention for incontinence. It's non-invasive. It's, I would say, routinely available, although pelvic PTs are still scattered throughout the US. And this is a really crucial role that we play here at Gaia, because not only can people access us easily, we can treat incontinence relatively quickly. This isn't something that's a death sentence. Like, when you experience this, it's because there's changes in the tissue. And although we might not be able to change the tissue, we can change everything around it. We can change how your body adapts to those changes. So part of what we do here is we do a full evaluation. So that's from head to toe. We talk about hydration. We talk about your movement postures. We talk about how you use your body. We talk about what you do in the bathroom or how often you go. By looking at all these different factors, both in your body and in your environment, we can usually come up with a solution. And the majority of patients that see us for simple urinary incontinence either completely eliminate or significantly reduce their symptoms. So we're going to jump to number 3, which may be a little uncomfortable for people, but it's really real and the myth is out there, and it's important to debunk because this doesn't just affect us, it affects our families and our partners. And so this misconception can lead to a lot of anxiety. It can have impacts on your relationships. And it's actually just more positive. Like, this is not This is not the case for everyone. So it's really something that we don't need to be afraid of. And a little bit of education is going to go a long way here. So it's actually been found that women postmenopausal actually have improved sexual satisfaction. Part of this is because they are less concerned about getting pregnant, they have increased self-confidence, they have a stronger emotional connection with their partners. So all of those things also reduce the emotional burden of intercourse at a younger age. But many of these women are not struggling with this issue postmenopausal. But there are very real changes that do happen in the body that can affect our sex life. And again, we come back to the estrogen. So estrogen is our sex hormone as females. As that declines, it affects many systems in our body, but particularly in the vaginal area, it causes a thinning of the tissue, and it also causes a dehydration of the tissue. And that can lead to pain and friction during intercourse that can be quite painful. Some women do experience a decrease in libido, and that is also because of a steady decrease in testosterone. Testosterone is still important for women and females, and there's a steady decline after about age 20 or 30 of testosterone. And there's also some other physical changes that happen to the tissue that might lead to discomfort during intercourse as well. The most important thing to take away here is that, one, the myth that it just goes downhill after menopause is just wrong. And there's studies that show that women have reported improved sex lives. There's also real tissue changes and real hormonal changes that can affect us here, but they're very treatable. And pelvic floor therapy is where we can step in with these symptoms again. So some of the things that we do in pelvic floor therapy can sound a little overwhelming and scary. The first being manual therapy. And I say that in a way because manual therapy can seem like, ooh, manual therapy there, that might not be comfortable. But what we do is we do assess the pelvic floor directly with internal exams, and we can provide muscle release there. So just like maybe you get a massage for your tight neck muscles, on a different scale, we do that in the pelvic floor, and that can cause a relaxation, increased mobility, and that can allow sex to be more comfortable. Sometimes we also use tools for this. So we might send you home with a tool that helps you to create relaxation or massage in these muscles. And having a home program that includes that can sometimes just hasten the speed of seeing improvement. We also do something called down training. So down training is an intervention that we use that we're just trying to get the pelvic floor muscles to release. It also really affects the nervous system. So if any of you have had pelvic floor therapy, especially with us before, you know that breathing is a huge component of what we do. Relaxation and stretches are all important components of this and can be strategies to decrease the nervous system and the muscle tension. Another thing that happens, I say nervous system because once you have pain with intercourse, maybe once, maybe a few times, your brain kind of remembers that and then becomes apprehensive. And so what happens is the next time maybe intercourse is on the table, your muscles are already kind of preparing for that discomfort. And so it creates tension and guarding, which then furthers the cycle of pain and difficulty with penetration. The exercises that we give can also, along with decreasing the muscle tension that causes pain, they can increase blood flow, they can enhance the coordination. So if there is difficulty reaching climax, sometimes working on the pelvic floor muscles themselves can actually help you achieve that. And outside of what we actually do in the clinic, we can talk about how to communicate the best with your partner. We can talk about the best lubricants to use because everyone should be using lubricant. Positions that might improve sensation, and just how we can start using our whole bodies for intimacy rather than just penetrative intercourse. All right, so this is a biggie. So have you all heard of hormone replacement therapy?
Yes, I'm currently on hormone replacement therapy.
Okay, fantastic.
And I've heard of it, but know nothing about it.
Okay, great.
Yes, I've heard of it.
Okay, awesome.
I've heard about it too.
Fantastic. Okay, so the big statement here is that hormone replacement therapy is unsafe for all women. And what has happened is this misinterpretation of the studies, that again, the medical system is generalizing a treatment that is very different from person to person, and they're kind of making a blanket statement, which is the big problem here. So what we do really need to know is that the majority of the benefits outweigh the risks. And especially for those under 60 or within 10 years of menopause onset, these are the women that really these are the ones that respond to HRT the best. There was a study that initially raised concerns several years ago. Recently, that's been reanalyzed, and it shows that since menopause, HRT significantly reduces the symptoms of menopause. It increases a person's quality of life, and the safety and efficacy are much higher than what were previously established. So this will be great for you, Steph, because of what you were saying. Systemic HRT is the most effective for vasomotor symptoms, which are the hot flashes and night sweats. So this is something that is definitely something that we should find you a provider to talk about. And it depends on how bothersome it is for you, but this is the symptom that is like most affected by systemic HRT. The other piece is bone loss, and there's also some heart health issues. So the earlier that we enter menopause, there's increased risk to cardiac and bone health. So we all know that women have higher risk of I want to say the medical term, heart attack, than men. And this is why. It is because with the lack of estrogen, our muscle system is not as efficient. And so HRT can be, when placed in that range, can be a very important, not only to manage the symptoms that are really uncomfortable right now, but they can also improve our overall health and wellness for decades down the road when it comes to fractures and heart attacks. The thing that's really important is when it comes to finding a provider, you need a provider that's going to listen to you. You need a provider that's well educated in HRT, and also a provider that's willing to tweak and find what works for you as an individual, and not just, oh, well, that's what I do for everyone. If that doesn't work for you, I don't know what else to do for you. Because it really is individualized. It depends on your symptoms. It depends on your preferences, your risk assess, your medical history, and the symptoms that you're trying to navigate, because they might not be the same for everybody. I just wanted to also make a comment on topical estrogen. This is not a new product, but it has also been reevaluated through a huge randomized controlled trial recently. And this is most important for the urinary and vulvar symptoms. So that would include burning, stinging, UTI-like symptoms, urgency, frequency, some leakage, things like dryness, pain with intercourse. So topical estrogen is basically like a cream or a serum that you put on the vulvar tissue, mostly on the outside. It's an external application. And this helps support the pelvic floor and the vulvar tissues in this area to reduce a lot of these symptoms. This product has had a black label specifically for anyone who has had any kind of risk, whether familial or individual, for breast cancer. And this randomized controlled trial that just came out a few months ago actually has shown that in all areas of health, like all systems of cardiac, bone health, endocrine, all of these different levels, even with those that have a higher risk with breast cancer, topical estrogen does not increase the risk of that person developing any kind of genital or breast cancer, which is huge because this should really be the gold standard in helping women with these, what we call genitourinary symptoms. So I just wanted to also make a comment on that, which is not systemic. So HRT, when we talk about HRT, is like a systemic, we're taking a pill, we're getting an injection. That's something that you're doing to help with more global symptoms. The topical estrogen is something that comes in a little tube and you rub on the outside to help with urinary and like outside skin type of sensations. I hope that's clear. Both really, really big in the research right now, and should hopefully be becoming more accessible since they don't have these labels on them anymore. All right, so our last one for tonight, and so we come back to bone health, and the myth is menopause means the end of bone health. And although there are real changes that happen to the skeletal system, this does not have to be the end all be all here. So the rate of bone loss increases the most in the first 4 to 8 years after menopause. And that is just strictly due to that very steep curve of the estrogen decline. What can be super helpful though, and this is from just like a physical therapy standpoint, but also just well-being and exercise. Weight bearing and resistance exercise are the exercise that is going to help you mitigate this. And although, yes, this is a very important thing to be doing when you're in menopause, really we need to be starting this process much before that. Because the bone loss is accelerated. However, when you do weight bearing or resistance exercise, that means anything where you are squatting, lifting dumbbells, using exercise bands. This is not so much like bike riding. This is not so much swimming. Although those are great movements, they don't really cause a increase in skeletal muscle or skeletal bone growth, which is what we're looking for here. Another way that we can intervene both during and before menopause is nutrition, making sure that we have good amounts of vitamins, vitamin D and calcium. And then if you are having symptoms or if you have a familial history of osteoporosis or osteopenia, there are medications that can help reduce the degree of bone loss. And I have to say, even though you might think that this is not an area where pelvic health PTs can be of value, this is where women's health and physical therapy just collide. Although you might not necessarily need pelvic floor intervention specifically, we are trained as physical therapists and occupational therapists. What we do is exercise therapy. That is the basis of our clinical education. So we design programs that are personalized to your goals, the activities that you like to do, and what your body needs. And we're focusing on those strength training tasks that are weight bearing with resistance that we know create the best bone growth. We also teach body mechanics and posture. We teach you how to reduce falls, modify activities so that we're not putting our bodies at risk when we know these changes are happening. And then if you have experienced a fall or you're just very unsteady on your feet, pelvic floor PTs can still be the people that provide balance, coordination, and fall risk training. So although it might not seem like we would be the ones that you would come to for those issues, in a place like Gaia, we are really the women's health specialists. So we're able to take care of you orthopedically, fall risk, pelvic floor, prenatal, postpartum, menopause, through all transitions, because it is the basis of our training. And we often work with other providers like nutritionists to make sure that you're doing your strength training and you're getting the benefits of nutrition counseling so that you can really be optimal. And I think the last thing to just consider is that there is this collision of like bone health and pelvic floor therapy. To have good balance, to reduce your fall risk, to be strong and healthy, you do have to have good pelvic floor training. Like you do have to have a strong pelvic floor. And so there is this collision of, we might not necessarily be doing localized pelvic floor treatment, but we do, as pelvic floor therapists, we have a more global approach of how the pelvic floor affects the whole body. So your menopause team should be many people, depending on what you're experiencing. But like I've said before today, it's not really just the professional that you're looking for. It's not just that you're looking for the endocrinologist or the cardiologist. You really need someone that's going to give you the answers and give you the time that you're looking for. If we're spot treating symptoms, cardiac symptoms, brain fog, incontinence, we're not seeing the whole picture. And so part of what we do here is we try to see the whole picture. Although there are limitations to what we can do, we help put that team together for you. So I think the biggest thing is, if you've seen an endocrinologist or a gynecologist and you're just getting dismissed and you're not getting the answers that you want, it's not necessarily that a gynecologist is not going to help you. It's that we need to find the right one for you. So our team here is myself and two others. Christine, she's here tonight with us. And we also have Anne Unhock, who has a really unique approach as an occupational therapist as well. So together, we probably have like 25, almost 30 years of experience in rehab. And I think this team is fantastic. I'm very proud of them. And we truly are able to say that we treat women holistically through the entire span of teenage years to having babies to after and through menopause. And we see those people in here every single day. So I really encourage you that if you are experiencing any of these symptoms, to consider reaching out to a pelvic floor therapist. We just have a different way of approaching healthcare in general. And of course you would receive treatment, but also a great thing about how we work, and especially here at Gaia, is we will try to build that team for you. We will have people to refer you to. We'll tell you what interventions are appropriate and how to seek out the best care for you. So this is just a small list of some of the conditions that we do treat here. Urinary incontinence, like we talked about earlier, is bladder leakage. We treat bowel dysfunction, which is anything from constipation to urgency to bowel leakage to hemorrhoids to tailbone pain. We treat pelvic pain conditions. This can be a history with endometriosis, bladder pain. This can also extend into hip and low back pain. Pelvic organ prolapse is something else that tends to reveal itself in this period as we decrease estrogen. So that's something that becomes prevalent and more, you're more susceptible to feeling, even if you've never had those symptoms before. And then we also have a special niche in treating the perinatal and postpartum population. So I hope you all found a little bit of information here that helps ease your mind, give yourself a little bit of information, allows you to realize that you're not alone, you're not crazy, help is out there for you. And I just want to express my gratitude for you being here with me today. I appreciate your time. Time is very valuable. And as an offer to you, if you are interested in scheduling an appointment here at Gaia, we're offering $40 off your initial consult if you book by Monday. And I will be happy to answer any lingering questions.